with the Health Secretary, Wes Streeting, who seamlessly switched in for Emma there. Very good morning to you, Health Secretary. Good to see you.
Good morning.
Tell us about how these new league tables are going to arise for NHS trusts.
So today we're publishing a set of league tables that use a whole range of data points to rank NHS providers, looking at the sorts of data that we often discuss on this programme, on things like ambulance response times or waiting times for planned treatment, right through to some of the data points that the public would not necessarily have so much access to, things like the NHS staff survey results or what the Care Quality Commission's data shows. And together we look at those factors, the financial leadership and performance, and we've ranked those hospital trusts. And the reason we're doing this is firstly to make sure that patients are better informed and are better able to exercise choice, but also so that consistent with the approach I've taken since I became Health Secretary last year, making sure that we have honesty, transparency and honesty about the variation in performance. I know there are some people that would rather we took the ostrich attitude, buried our head in the sand, or the spare the blushes approach of not setting out these data points. But I genuinely think that the public deserve to be well informed. And if we're not honest about the challenge and the range of challenges, then we're not going to be able to fix them.
What happens if you're in the top category? Do you get bonuses?
Well, yeah,
what happens if you're in the lowest category?
Yeah, so we're looking at things like capital incentives to incentivise high performance. And then in the lowest...
That's pay?
Those would be things like investment in those trusts to invest in things like new technology equipment or bricks and mortar. And then for the poorest performing trusts, there'll be a range of approaches. Where you've got poor performing leaders in poor performing trusts, then they will not receive their pay uplifts, and so there'll be effectively a financial sanction. Where we've sent some of our best performing leaders into the worst performing trusts, which is what we want to do, we're obviously not going to penalise the very people we've sent in to help us sort out some intractable problems. So there's some complexity that sits beneath this, but I do think that this is the right approach. I've seen criticism from some of the think tanks this morning saying, oh, well, is this necessarily helpful? What do the public really care about? I just think this is elitist nonsense, actually. The very same people who are out saying this are precisely the researchers who have access to these data sets and data points, who do understand the variation in performance and think it's, all right for them to understand it as researchers in London, but it's not, it's not OK to share that information with the public.
And obviously you've published these rankings this morning. I mean, if you look at a handful of the very top performing trusts and a handful of the very worst, is it very simple to say we can learn the lessons of what these guys are doing well and apply it to here? Or is there just a lot of local nuance to those that are struggling to perform?
I think a bit of both. So certainly if you take Northumbria, which is pretty much top of the table, Moorfields Eye Hospital's top of the table as a specialist hospital. Northumbria is the top performing non-specialist hospital. One of the things that makes them exceptional is they've integrated their accident emergency services with local community services to help patients get the right care in the right place at the right time. And in doing so, they've protected the elective activity, all the planned care, the operations people are booked in for, so that emergency care doesn't come at the expense of planned care. They're so well performing, that's why I nicked one of their former chief executives to come and run the whole NHS, Jim Mackey. So we will be taking the best of the NHS to the rest. Now, of course, there are some parts of the country where they have been consistently bottom of the table, and you have to look at issues of geography, demography. So there is that level of complexity, and as a government, we will take that kind of thoughtful approach. Most NHS leaders, most NHS staff and patients will welcome this approach. I have to say, in the last year, I've not found that I've been battling NHS managers. Actually, a lot of them share this government's determination, vast majority of them share this government's determination to get the NHS back to where it always should have been.
Sounds very interesting. I look forward to hearing what the results are in time. What's your message today to newly qualified doctors, the most junior doctors who are considering strike action?
Well, firstly, I absolutely agree with them about the challenge of doctor unemployment, and we're determined to deal with that challenge. We've got a new workforce plan in development. I recognise the problem they're up against, and against that backdrop, I mean, I must say it's similar to the wider dispute we've had with resident doctors on paying conditions. I'd say, look, you've got a government that fundamentally agrees with the problem and wants to work with you to solve it. Strike should always be the last resort. Industrial action should always be the last resort if you've got an intransigent employer or an intransigent government that isn't prepared to listen and work with you to sort the problem out. That's not the case here. So I think we've got the message, and I think it's totally legitimate of doctors to send us the message in the way that they have through this indicative result. But there's no need for strike action. In fact, going back to our previous conversation about NHS performance, strikes only sets back, makes things worse for patients, and it provides harder conditions for doctors and other NHS staff to work in.
I saw a story in the Times today about the number of sick days taken by British workers is at the highest level for 15 years. As a nation, do we need to toughen up a little bit?
I think this is a really serious challenge, and I think the health of the nation and the health of the economy are inextricably linked. And part of my job as the Health Secretary is to get people back to health, because in many of those cases, people will also be going back to work. There are all sorts of other challenges. We see rising levels of mental ill health and mental illness being a reason for people being off work. Now, there'll often be good reasons if people are in crisis not to go to work that day. But what we're also finding is that lots of people who are out of work because of their mental ill health end up becoming trapped outside of work, which ironically reinforces mental ill health and makes it worse. And that's why we've been looking at some of the best practice at hospitals like the Maudsley in South London, who've done a brilliant job of combining mental health recovery and treatment with employment support to help people, coach people, support people back to work. That's the kind of approach, the effective approach we want to take. And I'll be working very closely with Pat McFadden as the new Work and Pensions Secretary to tackle this problem of ill health and the health of our nation impacting on the health of our economy.
Let's touch on the deputy leadership race in your party. Obviously, some people coming out to say it's a stitch-up because of the timeline. Do you accept that if there aren't at least two candidates come Friday morning, that it will have been a stitch-up?
I think there will be two candidates, at least by the end of the week. I think we've got some fantastic people putting themselves forward. There is a tight timeline. There always is a tight timeline when a vacancy occurs when we are in government. And with respect to all of my colleagues and putting themselves forward and Labour Party members who will be voting, it is not the most important thing going on in the country today, and it won't be the most important thing going on in the country in the coming months. And we are the party of government now. That's got to be our first focus, our first priority, tackling the big issues that people want us to and elected us to tackle, whether that's the cost of living and the pain people are feeling in their pockets, the state of the NHS, or insecurity at our borders and on our streets. Those are our priorities, and the deputy leadership contest, while important for the Labour Party, mustn't and won't distract the Labour government from the important work that people sent us here to do.
So do you think that there's no need, therefore, for there to be a candidate who is also a government minister?
I don't think that's a precondition. I don't think they need to be. And I think there are. I look at some of the names that are currently circulating and people who are dipping their toes in the water and testing support among colleagues. We've got some brilliant ministers who are thinking of going for it, and then we've got some brilliant backbenchers who are thinking of going for it. I think the important thing is who's going to be our campaigner-in-chief? Who's going to be the person that helps us win those elections in Scotland, Wales and across England next May? Who's going to help broaden the appeal of the government? Those are the essential qualities for a deputy leader.
Who's your favourite pick?
I'm keeping my powder dry at the moment. I think there is a range of good candidates. I want to see the stall they set out before I decide who I'm supporting.
Final question. There's been another release of documents relating to Jeffrey Epstein's coming from Democrats in Congress, and some of them have included letters that appear to have been sent to Jeffrey Epstein by Peter Mandelson. Is it a problem that he's continued to be linked to Jeffrey Epstein whilst having such an important role?
Well, I think our ambassador has made it very clear that he deeply regrets ever having been introduced to Epstein, and frankly, given what we all now know about the way he conducted himself and the sort of appalling testimony we've heard from Epstein's victims, who would want to be associated with him, frankly.
so it doesn't lead to a change in ambassador or any consideration of that?
No, I don't think we should regard everyone as guilty by association. I think that the important thing is Epstein's victims receive the justice now and the platform now to tell their stories, to receive the hearing and the justice that comes from transparency and being now able to speak out in a way that sadly they weren't able to do while Epstein was alive. And it's really important that victims are believed, that they're given the space to set out their experiences, and that the justice that was not applied to Epstein in life can at least tarnish his name in death.